Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Silent Heart Attacks Go Undetected. And trust me, it's juicier than your cousin's peach cobbler. What if I told you that nearly half of all heart attacks happen without chest pain, shortness of breath, or any warning signs at all? Yep, entirely true. I can't make this stuff up. These silent heart attacks are destroying hearts across America, and most people don't even know they've had one. It's like having a burglar sneak into your house, steal half your valuables, and you wake up the next morning thinking everything's fine because the front door wasn't kicked in. So what exactly are these sneaky little heart destroyers? Think of a silent heart attack as the ninja of cardiac events. It damages your heart muscle just like a regular heart attack's. Same tissue death, same blocked arteries, same long-term problems. But it's wearing an invisibility cloak. Instead of that elephant sitting on your chest feeling we all know to fear, you might just feel like you ate some bad gas station sushi. Maybe a little jaw discomfort, some unusual fatigue, or what feels like heartburn after your morning coffee. Your heart tissue is literally dying from lack of blood flow, but your brain is sitting there like a clueless security guard, completely missing the alarm. It's particularly fond of picking on diabetics, women, and folks over 65. If you're checking any of these boxes, maybe I should see you in the clinic. We need to talk. Now, here's why these silent assassins are scarier than a horror movie marathon. Without treatment, that damaged heart muscle turns your cardiovascular system into a house built on a cracked foundation. Everything looks fine from the outside, but structural integrity, not so much. Silent heart attack survivors have the exact same increased risk of future heart problems as people who got the full Hollywood production with ambulances and dramatic chest clutching. The real kicker is that most people keep living their lives like nothing happened. They're still smoking, still eating fried everything, still treating exercise like it's optional because, hey, they feel fine. Meanwhile, their heart is limping along like a car running on 3 cylinders, just waiting for the next breakdown. Let me tell you about Maria, a 58-year-old teacher who walked into our clinic last month. She wasn't complaining about chest pain or dramatic symptoms. She just mentioned being tired after climbing stairs, figured it was part of getting older. Classic, right? We run an EKG, and boom, there's scarring from a heart attack she never knew she had. Blood tests confirmed elevated troponin levels, which is basically your heart muscle's way of leaving a crime scene fingerprint. This woman was walking around with a compromised heart, thinking she was just out of shape. Now she's on proper medications and monitoring, and we potentially saved her from what could have been a fatal second event. Sometimes being a cardiologist feels like being a detective, except instead of solving murders, we're preventing them. The good news is these cardiac ninjas leave evidence behind even when they think they're being sneaky. EKG tests can spot those telltale electrical patterns showing where heart muscle took a hit. It's like seeing scuff marks on the wall where the burglar bumped into furniture in the dark. Blood tests measuring troponin and CKMB enzymes can detect recent heart muscle damage. Think of them as the ultimate heart tattletales. Echocardiograms show us areas of the heart that aren't moving properly due to scar tissue. It's like watching a dance where half the performers forgot the choreography. These tests are quick, painless, and can easily be done during your routine checkups. No needles the size of garden hoses, no drinking chalky contrast material, just simple detective work. Here's your homework, and yes, I'm giving you homework because your heart depends on it. If you're over 50, diabetic, or have heart disease risk factors, march into your doctor's office and ask for an EKG at your next visit. Don't be shy about it. This is your heart we're talking about, not a dinner reservation. Stop ignoring those subtle symptoms that your body's trying to tell you about. Unexplained fatigue isn't always just Monday morning blues. Mild nausea isn't always something you ate. Back pain isn't always from sleeping wrong. Sometimes your heart is trying to send up flares, and you're mistaking them for fireworks. Early detection saves lives, folks. It's that simple. Your heart doesn't give out participation trophies, and second chances aren't guaranteed. Pay attention to your body, get those tests done, and don't let a silent heart attack write a check your cardiovascular system can't cash. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com later, y'all.